Third, integration with electronic health records, EHRs, and other health IT systems. Effective HIE requires seamless integration with various healthcare systems, including electronic health records, EHRs, electronic medical records, EMRs, laboratory information systems, LIS, radiology information systems, RIS, and pharmacy management systems. Integration ensures that data can flow smoothly between systems and that providers have access to the most current and complete patient information. EHR integration. Data exchange. EHR systems are central to the management of patient health records. For HIE to function effectively, EHR systems must be able to send and receive data in standardized formats, EAG, HL7, CCD, FHIR, that are compatible with the HIE platform. Bidirectional communication. Integration with EHRs allows for bidirectional communication between healthcare providers and HIE systems, ensuring that patient data can be updated in real time and reflected across all care settings. Data standardization. To ensure compatibility between different EHRs and HIE platforms, health organizations must adopt common data standards. This standardization helps eliminate variations in data formats and ensures accurate data exchange. Integration with other health IT systems. Laboratory systems. Integrating HIE with lab systems enables the exchange of lab test results, which can be critical for clinical decision-making. Integration with RIS also allows the sharing of imaging data, such as X-rays and MRIs. Pharmacy systems. Integration with pharmacy management systems allows for the sharing of medication histories, ensuring that all providers involved in a patient's care have accurate, up-to-date information on prescriptions and medication use. Challenges in integration. System compatibility. Many healthcare systems use different software and hardware platforms that may not be inherently compatible with one another. Achieving seamless integration requires overcoming technical barriers, including differences in data formats, protocols, and system interfaces. Data mapping and transformation. To integrate various health IT systems, data must often be mapped and transformed into standardized formats that can be exchanged between systems. Implementation and adoption of Health Information Exchange, HIE. The successful implementation and adoption of an HIE system is a multifaceted process that requires careful planning, effective stakeholder engagement, overcoming numerous barriers, and addressing technical and financial challenges. The key to HIE adoption lies in developing a robust framework that ensures secure, efficient, and interoperable data exchange across healthcare providers. Below is an exploration of the critical aspects of HIE implementation and adoption. 1. Steps for implementing an HIE network: planning, design, and deployment. Implementing an HIE network is a complex process that involves several key phases, each requiring careful consideration and resources. Step 1. Planning. Needs assessment and stakeholder analysis. Identify stakeholders. The first step in planning is to identify and engage key stakeholders such as healthcare providers, hospital administrators, IT staff, payers, insurance companies, and patients. Each stakeholder has unique needs and requirements that must be addressed for successful adoption. Define goals and objectives. Determine the specific goals of the HIE network, such as improving care coordination, reducing duplication of services, improving clinical outcomes, or enhancing administrative efficiency. Conduct feasibility study. A feasibility study should assess the technical, operational, financial, and regulatory considerations that could impact the design and implementation of the HIE. This includes evaluating available infrastructure, existing data standards, and compliance with regulations like HIPAA. Step 2. Design. Technical architecture. Design. Choose the HIE model. Based on the needs assessment, choose the most suitable architecture for the HIE, such as centralized, decentralized, or hybrid. Select data standards and technologies. Identify the data standards, e.g., HL7, FHIR, and interoperability protocols, e.g., SOAP, REST, that will govern the data exchange. Choose technologies that ensure secure transmission and storage of health data. Security framework. Design a security framework that includes data encryption, access controls, authentication protocols, and regular audits to ensure data privacy and protection against breaches. Infrastructure design. Network design. Ensure that the network infrastructure is scalable, secure, and capable of supporting the volume of data exchange required by the HIE. Cloud versus on-premises solutions. Depending on the organization's needs and resources, decide whether to host the HIE infrastructure in the cloud or on-premises. Cloud solutions can be more cost-effective and scalable, while on-premises solutions may provide more control over data management. Step 3. Deployment. System integration. Integrate the HIE with existing electronic health records, EHRs, laboratory information systems, LIS, pharmacy management systems, and other health IT systems to facilitate seamless data exchange. Pilot testing. Before full deployment, conduct a pilot test of the HIE system with a limited number of healthcare providers. This helps identify potential issues in system performance, interoperability, and user experience. Training and support. Provide comprehensive training to healthcare providers, administrators, and IT staff to ensure they understand how to use the HIE effectively. Ongoing technical support and troubleshooting should also be available. Go live. Once testing and training are complete, the HIE system can go live, with continuous monitoring to address any issues that arise during initial usage. 2. Overcoming barriers to HIE. Adoption. Financial, technical, and organizational challenges. Adopting and implementing HIE systems presents several challenges that must be addressed to ensure successful adoption across healthcare organizations. Financial challenges. High initial costs. The initial cost of setting up an HIE network can be significant, including costs for infrastructure, software development, security measures, training, and ongoing maintenance. Sustainability and funding. Even after initial setup, there are ongoing operational costs for managing the network, including server maintenance, data storage, and security updates. Many healthcare organizations may struggle with securing sustainable funding. Financial incentives. One way to address financial challenges is to offer financial incentives to healthcare providers for participation. Government programs, such as those available through Medicare and Medicaid, can provide reimbursements or funding for healthcare organizations that adopt EHRs and participate in HIEs. Technical challenges. Interoperability issues. Healthcare organizations may use different EHR systems and software platforms that do not automatically communicate with each other. Achieving interoperability requires standardizing data formats and protocols across different platforms, which can be time-consuming and costly. Data standardization. There may be discrepancies in how health data is structured, recorded, and interpreted across various systems. Standardizing data, e.g., using HL7 or FHIR, is essential for accurate and seamless data exchange. Cybersecurity threats. The exchange of sensitive health data opens up the system to potential cybersecurity risks, such as data breaches, hacking, or insider threats. Ensuring that robust encryption, authentication, and data access controls are in place is crucial. Organizational challenges. Resistance to change. Healthcare organizations and providers may resist adopting new technology due to concerns about workflow disruption, data privacy, or the perceived complexity of the new system. Overcoming resistance requires clear communication about the benefits and a well-designed change management process. Lack of skills and training. Many healthcare professionals may lack the technical skills to use HIE systems effectively. Comprehensive training and support are necessary to ensure staff members can fully utilize the system. Privacy and legal concerns. Healthcare organizations may be concerned about compliance with data privacy regulations, e.g., HIPAA, GDPR, when exchanging health data. Ensuring that the HIE system adheres to privacy laws and has robust security measures in place is critical for overcoming these concerns. Third, stakeholder engagement, ensuring buy-in from providers, administrators, and patients. Successful HIE adoption requires the engagement and active participation of all stakeholders, including healthcare providers, administrators, and patients. Engaging healthcare providers. Demonstrating the benefits. Providers need to understand how the HIE system will improve patient care, streamline workflows, reduce administrative burdens, and help them make informed clinical decisions. Highlighting these benefits can encourage participation. Training and support. Ensuring that healthcare providers are adequately trained in how to use the HIE system is essential. Ongoing support and troubleshooting must also be available to address any concerns providers may have during the transition. Incentivizing participation. Providing financial incentives, such as reimbursement for adopting and using the HIE system, can motivate providers to participate. Additionally, demonstrating how HIE can improve clinical outcomes may encourage providers to actively engage with the system. Engaging healthcare administrators. Leadership support. Senior healthcare administrators must be on board with the HIE initiative and provide leadership throughout the process. Their support is essential for securing resources, aligning organizational goals, and overcoming resistance. Operational efficiency. Administrators should be shown how HIE can reduce costs, improve operational efficiency, and support better decision-making. For example, by reducing redundant tests and improving care coordination, HIE can lead to cost savings in the long term. Data privacy and compliance. Administrators must ensure that the HIE system is compliant with all relevant regulations. Engaging with legal and compliance teams to address privacy concerns is crucial for gaining organizational buy-in. Engaging patients. Informed consent and education. Patients must understand how their data will be shared and the benefits of participating in the HIE network. Informed consent must be obtained, and patients should be assured that their data will be protected according to privacy laws. Transparency. Providing patients with access to their health records and showing them how HIE participation improves care coordination and outcomes can foster trust and increase adoption. Patient empowerment. Encouraging patients to actively participate in their care by having easy access to their health information can improve patient engagement and lead to better health outcomes. Interoperability in Health Information Exchange, HIE. Interoperability in Health Information Exchange, HIE, refers to the ability of different healthcare systems and organizations to exchange, interpret, and use patient health information seamlessly, regardless of the technology, system, or organization involved. Achieving interoperability is crucial for realizing the full potential of HIE, as it enables more effective care coordination, improved clinical decision-making, and a reduction in errors and inefficiencies. Below, we explore key aspects of interoperability in HIE, including standards, challenges, and emerging solutions. 1. Understanding interoperability, key standards and protocols. Interoperability in HIE relies on the use of specific standards and protocols that ensure consistent, reliable, and secure data exchange between different healthcare systems. Several key standards and protocols are essential in facilitating interoperability. Key interoperability standards. HL7, Health Level 7. Overview. HL7 is one of the oldest and most widely adopted standards for healthcare data exchange. It defines messaging protocols that allow different healthcare systems to communicate. Importance in HIE. HL7 standards, such as HL7v2.x for messaging and HL7v3 for document-based exchanges, are critical for facilitating the transfer of clinical data such as patient demographics, diagnoses, lab results, and medication orders. Challenge. HL7v2.x, while widely used, lacks flexibility and is often difficult to maintain, leading to compatibility issues between systems. FHIR, Fast Healthcare Interoperability Resources. Overview. FHIR is a modern, web-based standard developed by HL7 that enables easier, more flexible, and faster data exchange through RESTful APIs, application programming interfaces. Importance in HIE. FHIR enables seamless exchange of healthcare data using simple, lightweight formats like JSON and XML. Its use of RESTful web services makes it highly adaptable for integrating with cloud-based systems, mobile devices, and emerging technologies. Challenge. While FHIR offers significant advantages in terms of flexibility, widespread adoption is still in progress, and there are challenges in ensuring full data standardization and interoperability across healthcare organizations. CDA, Clinical Document Architecture. Overview. CDA is a standard under HL7 that defines the structure for clinical documents, such as discharge summaries, progress notes, and diagnostic reports. It ensures that documents are both human-readable and machine-readable. Importance in HIE. CDA is useful for sharing structured clinical documents across systems while ensuring consistency in document formatting. CCD, Continuity of Care Document. Overview. CCD is a standardized document format under CDA that allows healthcare providers to share a patient's medical history, including medications, allergies, diagnoses, and other critical information. Importance in HIE. It is a key component for sharing patient care summaries between different healthcare settings, ensuring better coordination and continuity of care. ICD-10 and SNOMED-CT, Systematized Nomenclature of Medicine Clinical Terms. Overview. These coding systems are used for classifying diseases, conditions, and medical procedures. They are essential for ensuring that data shared across systems is consistent and understandable. Importance in HIE. Standardized coding systems like ICD-10 and SNOMED-CT are crucial for accurate diagnosis and treatment tracking, helping improve communication across healthcare systems.